I am very happy to have this opportunity to share with you information about a very important topic, and that's the impact of soy on the risk of developing breast cancer and on the prognosis of breast cancer patients. I'm sure it comes as no surprise to any of you that the relationship between soy and breast cancer has been very intensely investigated over the past 30 years, and there is certainly a lot of internet discussion about this topic. And we see that this question is important to physicians as well. This is a clinical inquiry which was published last year in the Journal of Family Practice, which is a journal that targets physicians, asking whether soy intake prevents the development of breast cancer and whether it affects the recurrence of breast cancer, and that's precisely the topic that I'll be addressing. So why all the interest in soy? Well, very simply, it's because soy foods are a uniquely rich source of a group of naturally occurring plant chemicals called isoflavones. If you consume a diet that contains soy foods, your diet is high in isoflavones. If you don't eat soy, it's almost devoid of isoflavones. So here we see average intake of isoflavones in Japan is about 30 to 50 milligrams per day. In Europe, it's less than 2 milligrams per day. One serving of a traditional soy food, such as 250 milliliters of soy milk, made from whole soybeans, provides about 25 milligrams of isoflavones. So Japanese consume about 1 to 2 servings of soy per day. The main isoflavone in soybeans is genistein, and you can see on the right-hand portion of the slide that isoflavones have a fairly similar chemical structure to estrogen. Now, isoflavones are diphenolic molecules, they're not steroids, but they do bind to estrogen receptors. As a result, under certain experimental conditions, isoflavones exert estrogen-like effects, and for that reason, they're classified as phytoestrogens. But it's very important to recognize that isoflavones are very different from the hormone estrogen, and they are actually more accurately classified as selective estrogen receptor modulators rather than just phytoestrogen. Pharmaceutical examples of selective estrogen receptor modulators are tamoxifen and raloxifene. Both of those drugs are used to treat breast cancer. SERMs have tissue-specific effects. In one tissue that has estrogen receptors, they can exert estrogenic effects. In another tissue, they can actually exert effects opposite to those of estrogen. And in some tissues that are affected by estrogen, they may have no effects at all. The preference for isoflavones to bind to estrogen receptor beta in comparison to estrogen receptor alpha is at least part of the explanation for why isoflavones can function as selective estrogen receptor modulators. So isoflavones prefer estrogen receptor beta. The hormone estrogen likes each of these two receptors equally. And this difference is important because these two receptors have different tissue distributions within the body, and when activated, can have different and sometimes opposite physiological effects. And that appears to be the case in the breast, where activation of estrogen receptor beta inhibits the proliferative effect of activation of estrogen receptor alpha. So it's thought that if you have a molecule or a ligand that specifically binds to estrogen receptor, that it will decrease breast cancer risk and promote breast health. And in fact, research in general suggests that molecules that target estrogen receptor beta may have a role in preventing and treating a variety of different cancers. So now we have a little bit of an understanding of isoflavones at the molecular level, But oftentimes our molecular understanding isn't very predictive of clinical effects. But we do have many, many clinical examples illustrating that isoflavones differ from the hormone estrogen. So in this slide, E2 is representing estrogen and IF represents isoflavones. So you can see that estrogen stimulates vaginal tissue, reduces bone loss in postmenopausal women. It may stimulate breast tissue, and I'll talk about that in a bit, and it probably increases blood clot formation. Isoflavones don't have any of those effects. On the other hand, both estrogen and isoflavones alleviate hot flashes, improve endothelial function, which is the thin layer of cells that line your blood vessels, and there's speculative evidence that isoflavones, like estrogen, improve skin health. So with that background in mind, let's take a look first at the question of whether soy foods help to prevent breast cancer. Of course, we all know that breast cancer rates are low in countries that regularly consume soy foods. We also know, unfortunately, that in countries that consume soy foods, breast cancer rates have increased quite dramatically. Here we have the results of research from Japan showing over a recent 40-year period, breast cancer rates increased about threefold. This is without question due to westernization of the culture. The extent to which westernization of the diet is responsible for this change is unclear. But these kind of ecological data and looking at trends are useful for generating hypotheses, but if we're going to reach any meaningful conclusions, we need to look at other types of data. The real question is whether women who consume soy are less likely to develop breast cancer in comparison to women who don't consume soy. We have some interesting answers to that question from a meta-analysis of observational studies that was published in 2014. The study included the analysis included 30 studies involving premenopausal women and 31 studies involving postmenopausal women. So this is an analysis of epidemiologic studies comparing high soy intake with low soy intake. High soy intake among studies involving Western women was not associated with the reduction in breast cancer risk. In contrast, high soy consumption among Asian women, both premenopausal and postmenopausal, was associated with the 41% reduction in risk. So what are the possible explanations for why we see that soy reduces breast cancer risk in Asian women but not Western women? Well, one is that Western soy intake is simply too low to exert beneficial effects. I presented early on data showing that isoflavone intake in Europe is less than 2 milligrams per day. The second explanation is that for soy to reduce risk, it must be consumed early in life. Let's take a look at this first explanation. It's very difficult to get useful insight into the health effects of soy by looking at Western epidemiologic studies because soy intake is so low. But there are a couple studies, which you've already heard about today and yesterday, the Adventist Health Study and the EPIC Oxford study, that can tell us something about soy. Because as you know, if you look at the EPIC Oxford study, they oversampled for vegetarians. So many of the women in this study were consuming soy in amounts similar to what you would find in Japan. So for this analysis, 37,000 women were followed for an average 7 years. During that time, there were 600 cases of breast cancer. The women were divided into tertiles according to the amount of isoflavones they consumed, And these are the kind of tertiles that you would see in many Asian epidemiologic studies. And what do we see? Absolutely no indication that soy intake reduces risk in this cohort of women. The thinking is that most of these vegetarians likely adopted their way of eating during adulthood, and so were not exposed to soy when they were young. So let's examine the evidence in favor of the second explanation. To reduce risk, soy needs to be consumed very early in life. This hypothesis is actually consistent with a growing school of thought, emerging evidence, that maintains early exposures in life, both dietary and environmental, have a profound impact on risk of developing a variety of different cancers in adulthood, not just breast cancer. The hypothesis that early soy intake reduces breast cancer was proposed in 1995. So it's been investigated for more than 20 years. There are animal data in support of the hypothesis, epidemiologic data in support of the hypothesis, and we actually have a pretty good understanding of why it looks as though consuming soy when you're young reduces breast cancer risk. So let's take a look at the epidemiologic data. 4 studies have evaluated this hypothesis. 2 were conducted in China, 2 in the United States. All 4 studies involve women of Asian ethnicity. In the third column, you can see the number of participants in each study. And what they were doing was comparing high soy intake during the teenage years with low soy intake. So they recruited a group of women. One group had breast cancer, the other one did not. They interviewed the women to determine how much soy they consumed when they were young. And what we see is that consuming higher amounts of soy during the teenage years was associated with anywhere from a 28 to 60% reduced risk of breast cancer. High soy consumption was approximately 1 to 1.5 servings per day. I mentioned we have a pretty good understanding of why we think soy is protective against breast cancer. To sum up the evidence, what we think happens is that for a number of different reasons, isoflavone exposure in the developing breast causes the breast cells to be changed in a way that permanently makes them less likely to be transformed into a cancer cell later on in life. So although this hypothesis remains speculative because we don't have any clinical data, and in my view, you need clinical data to reach a firm or a definitive conclusion, I strongly recommend that all girls consume at least 1 serving of soy per day. It's a nutritious food. It's easy to incorporate soy into the diet. What about the second part of this discussion? Can soy foods be safely consumed by breast cancer patients? This has been a very hotly debated topic for at least 20 years. I'm happy to report that the data, in my opinion, now allow us to resolve this controversy. The theoretical concern about soy and breast cancer is based on the assumption that estrogen increases breast cancer risk and may worsen the prognosis of breast cancer patients. But you may be surprised to learn that estrogen exposure, estrogen therapy, like hormone therapy, actually appears not to increase the risk of developing breast cancer. This is a recent conclusion from the U.S. Preventative Services Task Force recommendation statement. The use of estrogen alone results in a small reduction in the risk for developing or dying of invasive breast cancer. This conclusion is not at all surprising when you look at the results of the Women's Health Initiative trial. This is the largest trial of its kind ever conducted. It involved 10,000 women, 5,000 in the placebo group, 5,000 women were given conjugated equine estrogens, a form of estrogen. Regardless of the age at which the women were when they were enrolled in this study, what we see is that women in the estrogen group, shown in green, were less likely to develop breast cancer. And when you look at all women in the study, estrogen exposure was associated with a statistically significant decrease in the risk of breast cancer. So if estrogen therapy doesn't increase breast cancer risk, it's going to be very unlikely that isoflavones will. Nevertheless, animal research published in the 1990s did find that if you give a certain type of mouse that doesn't have ovaries and doesn't have an immune system, if you give that type of mouse isoflavones, it will stimulate the growth of existing mammary or breast tumors. But I'm sure you all agree that animal studies really do a poor job at predicting effects in humans. Now, no trials have actually evaluated the impact of isoflavones or soy foods on breast cancer recurrence or breast cancer mortality. No clinical trials. But we do have lots of clinical data that have evaluated the impact of soy and isoflavones on indicators or markers of breast cancer risk. These studies have involved healthy women, women at risk of developing breast cancer, and women with breast cancer. So markers or indicators include breast tissue density, which you can measure by mammogram, and breast cell proliferation. These studies are really the gold standard. For these studies, you actually have to take a biopsy of the breast before and after exposure to isoflavones or soy. All other things being equal, if cell proliferation increased, because those cells have less time to repair DNA damage, it means that cancer risk will be increased. And what we find in all these studies is that soy has absolutely no adverse effects on breast tissue. This is a very powerful argument for the safety of soy foods. Furthermore, the amount of isoflavones in soy that were given to the women in these studies exceeded typical Asian intake quite dramatically in some cases. So here we have the 6 studies that actually looked at the effect of soy on breast cell proliferation. You recall that the average intake of isoflavones in Japan is about 30 to 50 milligrams per day. Here we see in the very right-hand column that 4 studies actually intervened or gave the women more than 100 milligrams of isoflavones. That's about twice the typical amount consumed in Japan. The study by Khan intervened with 235 milligrams of isoflavones. And because of the type of isoflavones that were given to these women, that's equivalent to 15 servings of soy foods, and yet there were still no adverse effects on breast tissue. In contrast to isoflavones, if you give hormone therapy, the combined hormone therapy, estrogen plus progestin, for just 12 weeks, you see an increase in breast cell proliferation of 4 to 10-fold, and we know that this type of hormone therapy increases breast cancer risk. So it's not at all surprising that the American Cancer Society and the American Institute for Cancer Research have concluded that soy foods are safe for breast cancer patients. This was also the conclusion of the European Food Safety Authority, which examined this issue at the request of the BFR in Germany back in 2008. They just published their comprehensive multi-year report and concluded that isoflavones don't adversely affect breast tissue in postmenopausal women. Now, the World Cancer Research Fund International just recently identified eating soy foods as possibly improving the survival of breast cancer patients. Now, why did they reach this conclusion? Well, very simply, because there is a large amount of epidemiologic data indicating that consuming soy after a diagnosis of breast cancer actually improves prognosis. Here we have a meta-analysis published in 2014. There were 5 epidemiologic studies, prospective studies in this meta-analysis. 3 studies were conducted in China, 2 in the United States. You can see the number of women in each of these studies, the number of deaths from breast cancer, the number of women that had a recurrence of their disease, and then the median time they were followed. It ranged from 3.9 years to 7.3 years. So 11,000 women with breast cancer, and the studies looked at soy consumption after a diagnosis of their disease. And here we have the hazard ratios comparing high soy intake with low soy intake. If the value is below 1, it means that soy is protective. If it's above 1, it means that soy is harmful. And here we see, when we look at the data for mortality overall, a 16% reduction in the risk of dying from breast cancer. That was statistically significant, and a 26% reduction in the risk of having a recurrence. So higher soy consumption after diagnosis of breast cancer is protective. And I want to draw your attention to the results with tamoxifen users, because I mentioned there was an animal model that showed isoflavones stimulate the growth of existing mammary or breast tumors. That same model also found that isoflavones inhibit the efficacy of the breast cancer drug tamoxifen. This analysis of 11,000 breast cancer patients actually suggests that consuming soy enhances the efficacy of the drug tamoxifen. And we also have evidence that consuming soy enhances the efficacy of aromatase inhibitors. Aromatase inhibitors inhibit the synthesis of estrogen. They are really the drug of choice now for treating breast cancer. Here we see a very small study from China. 113 breast cancer patients were on anastrozole, the aromatase inhibitor. Higher soy intake decreased their risk of dying from breast cancer. So we're seeing that the human data directly contradict the findings in animals. So I mentioned at the very beginning that the physicians are very interested in this topic, and this inquiry was published in the Journal of Family Practice, a journal targeting physicians. The answer that they published is consuming a diet high in soy is associated with a 25% decrease in risk and recurrence and a 15% decrease in risk and mortality. So I'm pleased to say that this information is making its way to the medical and scientific communities. So in conclusion, consuming soy when young appears to reduce breast cancer risk. Clinical data shows soy foods don't adversely affect breast tissue, markers of breast cancer risk. And prospective observational or epidemiologic data show consuming soy after a diagnosis of breast cancer improves prognosis, decreases recurrence, and decreases mortality. Thank you very much for your attention.